Can't change that. Hope you guys are doing well. My name is Dr. Isang. I am on a 24-hour call. I've done, I don't even know, 6, 12, about 18 hours of it. So now I'm just preparing for my patients for tomorrow, but using this platform to be able to answer any questions you guys may have about becoming a doctor, about cardiology, and about just anything in regards to medicine that I can be of assistance of. Once again, I'm a cardiologist, but I try to answer questions regarding that and, prevention, but using this time to be able to answer any questions you guys may have about becoming a cardiologist. If you guys have any questions, let me know. In the meantime, I'm just going to finish some of these notes. Now, I finished, prepare for the next day, and we'll see. I think I should use that light instead. For those of you guys coming in, welcome. Just finishing up, not finishing up, preparing for the next day. Tomorrow's my short call day, so I'm pretty excited about that. I'll be done hopefully around 4 p.m. and then take my daughter to swimming practice, so I'm excited about that. Very excited. DJ Sunflower, hope you're doing well. I'm doing well. Finishing up some notes. Keep on saying finishing up notes. Preparing for the next day. Preparing for my last inpatient day. Off for 2 days, and then I'm on call on Sunday. So I'm excited about that. But while I'm preparing for the day, I'm just going to answer any questions anybody may have about becoming a doctor, what it's like to be a doctor, what it's like to be married to another doctor. So for those of you guys who just popped in, my name is Dr. Isang, and I'm a cardiologist. I'm preparing for the next 24. New to your channel, thank you for showing up. I'm Dr. Isang, I'm a cardiologist. It took me 14 years to get to become a cardiologist, so I try to discuss the things that I tell my patients, especially when it comes to prevention, because a lot of times if you can, understand what the risk factors for heart disease are, and you can potentially prevent it from happening. So if you understand that things like high blood pressure, diabetes, smoking, they all play a huge factor into your into your heart disease, and if you can treat that, our goal is to hopefully prevent someone from having a heart attack in the first place, or worst case scenario, delay it from happening. So instead of happening in the 40s, 50s, maybe delaying to 80s, 90s. Michaela Green, I hope you're doing well. Mickey B, I hope you're doing well. Thank you. I am doing well. Just preparing for tomorrow. You never know. You never know what these call days can. What will occur in these call days. So I'm just trying to read up and make sure that I'm not missing anything. Got it. J-Man Lincoln, man, I hope you're doing well. Hope you guys are all doing well. If you guys have any questions in regards to your heart health prevention, any medical questions I can potentially be of assistance, let me know. If not, just jam with me while I'm reading up, making sure I'm not missing anything. One of my patients is going for a cardioversion tomorrow, so it's a procedure where we shock them back into normal rhythm. We'll likely need a transesophageal echocardiogram prior to it, so that's to make sure that there's no clot in the heart, because you don't want to shock someone to have a clot in the heart. If you do, that clot can lead to a stroke. Lakila, hope you're doing well. Shani Watson, hey, what is going on? You're an OG. I hope you're doing well. Hope life has been treating you well. It's been a long time. Thank you for the comments too. Thank you for just who you are. And also, let me know if you guys are hearing me okay too. Make sure that the music isn't too loud. Okay. Lakila, what is going on? Hope you're doing well. Feel free to ask any questions you guys may have. This one has atrial fibrillation, but the issue is that has elevated times of really, really high heart rates and times of really low heart rates. This is known as tachybrady syndrome, and we can control the high heart rates with a pacemaker, but with a medication called metoprolol, but sometimes it can be difficult to control the low heart rates. In those scenarios, they may need a pacemaker. Yeah, I'm a fan of Trulicity. It's one of the newer medications for diabetes, but more specifically, a lot of these new medications, especially diabetic medications, I am glitching. A lot of these new medications are also tested for cardiac benefits, and that specific medication has been shown to have some cardiac benefits, preventing heart attacks, worsening heart attacks, etc. That's awesome. Congratulations, Shanine. I know it's a long process, and I thought based on some of the videos I've seen for you that you would do something in regards to helping people. Excuse me. LDL is 127. How can you lower it? Well, the first one is going to be exercise is going to be the biggest one. It may not lower it as much. Ideally, your LDL should be, for all comers, less than 100 or 100, around 100 or less. If you've had a cardiac event or if you're diabetic, around 70. If you've had significant cardiac events with stents, then less than 50. If you've had multiple cardiac events, less than 40. Best way is going to be exercise, but also nutrition. You have to think that your body makes cholesterol through your liver. So the other ways that you can get it is from what you're eating. So animal products are packed with it, processed foods. So watching nutrition, watching how much red meat you're consuming, how much animal products you're consuming is one of the ways. And if those are not helpful, then medications, statin therapy. If you don't want to use medications like that, and one of the things you can look at is red rice yeast, red yeast rice, but it's basically where statins were created from. I actually did a pretty good job with my patients and making sure that I wasn't missing anything. So the only thing that I actually have left to do is I have some echocardiograms, which are ultrasounds of the heart. That lets me look at how well the heart is squeezing, make sure the heart's squeezing well, issues with the heart valves, making sure there's no fluid around the heart, and it may be an early night for me, but if you guys have questions, I'll stay on and answer as many as I can. So that's a good question regarding statins and LDL. So in the world of cardiology, one of the biggest things, in addition to that we get concerned about is poorly treated blood pressure, poorly treated hypertension. One of my, someone on social media had called me out saying that in the 1970s, a normal blood pressure was 160 or less, and now we're pushing for 120 or less. And the reason behind that is because of research. We've done enough research to show that the higher the blood pressure is, the harder the heart has to work, and it can lead to things like strokes, heart failure, heart attacks, kidney failure, needing dialysis. So in the mid 2010s, 2015, there was a trial that was done for about 4 or 5 years called the SPRINT trial. It enrolled almost 1,000 people. Split them into 2 different groups. One were lenient with blood pressure control, meaning around 140. The other group was around 120 or less. The ones that had 120 or less had decreased risk of strokes, decreased risk of heart attacks, decreased risk of heart failure, decreased risk of hypertension. Caveat, some of them had lower blood pressures, which can lead to lightheadedness and dizziness. So when I see someone with hypertension, I want to, look at them as an individual and make sure that their blood pressure isn't affecting them, isn't causing heart failure symptoms, they don't have other risk factors like diabetes, which can make increase the risk of things like kidney failure. So I treat the patient, not the number, but I also understand that lower the blood pressure is, the lower risk of significant cardiac events. I am a cardiologist, heart doctor. So, the question is, how long does it take to become a cardiologist or a heart doctor? You're looking at 4 years of undergrad, 4 years of medical school, 3 years of internal medicine residency, and then 3 years of cardiology fellowship. So it's a total of 14 years, including college, to become a cardiologist. Definitely a long process, but man, it's so worth it. And there's not enough doctors that look like me, especially cardiologists. As a cardiologist, one of the common things that I get consulted for is chest pain. So what is chest pain that is concerning for a cardiologist? You have chest pain here. Pain sometimes moves to the shoulders, but pain that's worse whenever you're stressed or exert yourself can be very concerning. Pain that is better with rest or medication called nitroglycerin is concerning. If you have all of those, I'm concerned that you may be having significant blockage in your heart arteries. The worst case being a heart attack. So definitely want you to be seen as soon as possible by your medical provider, urgent care, or even a emergency department to make sure that your discomfort isn't due to a heart attack. So we run certain tests, get a history, get an EKG, and if everything is concerning, then we do a heart catheterization to make sure there's no blockage. If things are okay in the hospital, then we may do a stress test or an echocardiogram, ultrasound the heart, just to make sure that we're not missing anything else. If all of those are normal, then we would have the people follow up with us outpatient, but also continue workups to make sure something else isn't causing them to have this discomfort. Right now I'm just reading echocardiograms, ultrasounds of the heart. These are the ones that I ordered in the outpatient setting, so you definitely want to get them read with it within 48 hours, ideally within 24 hours, but I'm not always perfect, but I strive to become a little bit better every day. So this is, What else question do you guys have? Leave it and I'll do my best to answer it. There's one. So when it comes to uh, one of the dreaded things that we see in cardiology is heart failure. So when someone has heart failure, that's when their heart is not pumping appropriately. It's basically categorized into two different forms, whether your heart is weak and it's not pumping well. Most common cause of that is due to a heart attack. So if you have that, we want to, which is also known as systolic heart failure, we want to do a heart catheterization to make sure that there's no blockage, because if there's a blockage, we can open it up and then potentially try our best to restore that heart function to how it was prior to the heart attack. The other form of it is due to a stiff heart. And you can imagine the heart is stiff, blood is not moving forward, it's backing up, and it can back up into the legs, causing leg swelling, can back up into the abdomen, causing abdominal swelling and weight gain, can back up into the lungs, causing cough, shortness of breath, can lead to people waking up and gasping for air from time to time. So if that, and the most common cause of that is going to be due to high blood pressure. So treat the blood pressure and make sure something else isn't causing it. Sleep apnea, autoimmune conditions, issues with hormones are typical causes too, but the most common is due to high blood pressure. Gosh, is that high? Casey Walls, I hope you're doing well. How are you doing? Good evening. I'm a heart doctor, a cardiologist. Any questions you may have regarding your heart, do my best to answer it. Any tips on how I get heartburn so bad that I run out of breath? I cough and nothing comes up and my throat is always dry. The biggest thing you gotta consider, I'm not a stomach doctor, but with heartburn, certain foods can be triggers. So if you notice that it's happening certain days worse than others, or one of the things you can do is kind of keep either a food diary or a mental mental note about what you're eating on certain days, and whether you're having worse symptoms on those days versus other days. Worst case scenario, sometimes it can also be an ulcer too. So if medications like over-the-counter Tums and things like that are not helping, you may need to see a stomach doctor. I'm tripping, keep on making the same mistake. Biggest pet peeve being a cardiologist, a certain blood test that hospital likes to order that gets ordered incorrectly. We order it when someone is having a heart attack. It can help to confirm it, but if you order it for other reasons, or if you order it incorrectly, it'll lead to them consulting us. That's inappropriate. So if you have an infection, if you have any type of trauma, it can lead to the enzyme being elevated. So a lot of times people will come in with an infection and they'll order that blood test. It'll be positive and then they'll consult cardiology. And our plan is usually treat the underlying illness. Take 40 milligrams of Prilosec and the heartburn is still horrible. I would definitely follow up. I recommend following up with your medical provider to make sure something else is a need. Something like Nexium, which is a little bit stronger, or even seeing a stomach doctor. That's my boy. I got probably 10 more minutes on here, but if you guys have any questions, you let me know and I'll do my best to answer it. more questions, let me know. Just finishing up reading some echoes, and then it's gonna be a night for me. Apple cider vinegar, it'll be gone in seconds. Which may be true, but if it's due to something like, an ulcer, well, possibly not, but listen, man, like these remedies, apple cider vinegar has a lot of interesting benefits I've come to realize. One of the ultrasounds that I'm reading is for a heart murmur, and there's one of the valves is leaking a little bit. So one of the biggest recommendations typically is to follow up and see how that leak is in about a year. I got one more ultrasound to read, and if you guys don't have any further questions, I'll be hopping off of here, but let me know. Hypertensive heart valve. Rephrase that. Hypertension can lead to heart valves having issues, but I've never heard it phrased as a hypertensive heart valve. What exactly were you told? And I can kind of help to discuss that a little bit more. But one of the things that I have seen is one of my patients has a very leaky valve, but that leaky valve is also dependent on their blood pressure. So a lot of times it leaks when the blood pressure is poorly controlled, and it doesn't leak as much when we have it controlled. So a lot of times when my patients have a leaky valve, and we're considering surgery, one of the things that we stress is the importance of controlling the blood pressure. So we do everything that we can to control it, to see if it leaks less, and if it does, then we just continue with medical management. We're just controlling the blood pressure versus having to consider things like open heart surgery. All right, that is it from me for today. Anita, if you have any questions, you can reach out to me on all the social media platforms, and I'll be able to answer those questions a little bit better. Truly, truly, truly appreciative for you guys even taking time to listen to me talk about this. So, if you guys, like I said, if you guys have any other questions, let me know. And Shani Watson, always a great great time talking to you, and good luck with everything. I hope that I don't know what to say. I hope that the time that you've been a therapist, you've been a blessing to other people as you have been to me, and I hope that you're finding really good satisfaction in your job. Just understand and know that you are truly needed in this world, especially with everything that's going on. So thank you for answering the call to become a therapist. You guys take it easy.